and welcome to SRM Spokane. We're a full-service satellite clinic of Seattle reproductive medicine dedicated to providing compassionate, comprehensive care to help our patients find their best path to parenthood. We're conveniently located off of Interstate 90 at the Sullivan exit in Spokane Valley. SRM Spokane extends fertility expertise across the Pacific Northwest, making care accessible to patients in eastern Washington, Idaho, and Montana. We offer a comprehensive range of fertility treatment options, including ovulation induction with timed intercourse, intrauterine insemination, in vitro fertilization, as well as medical and social fertility preservation. Upon arrival, you'll be greeted by a receptionist for check-in for your consultation.
Hi, my name's Jamie. I'm one of the receptionists here at SRM. When you arrive for your visit, I will check you and your partner in, verify your insurance, and collect any records or co-payments required.
In this video, we'd like to give you a glimpse of the clinic as well as the team members you'll be working with throughout your treatment. So without further ado, please meet Dr. Brenda Homard.
Hi there. I am so happy that you are watching our video, and I can't wait till you come into the clinic. My name's Brenda Homard, and I'm a reproductive endocrinology board certified physician, and I will help you in your journey with us. The first thing that you're going to do is come into my office for a new patient visit, and we'll go through all of your history, all of the evaluation you've had to date, if any, and we will figure out what we need further to help you. I deal with fertility patients, both primary infertility, meaning you've never been able to get pregnant. Perhaps you have secondary infertility, which means you may not have had trouble conceiving the first time, but now for the second or third, you're having a little bit of issue. We deal with recurrent pregnancy loss, which is those people that do not have trouble getting pregnant but have trouble staying pregnant, and non-fertility reproductive problems such as polycystic ovarian syndrome. Once we figure out what follow-up you'll have that in the rest of the clinic, and then come back into my office and we'll talk about your situation, your evaluation, what we're going to do for treatment. I am very pleased that we are part of Seattle Reproductive Medicine. The remainder of the clinics are on the west side, and we have over 15 physicians that are board certified reproductive endocrinologists or dedicated to infertility or deal in male infertility. And they can participate in giving opinions on your care. I look forward to meeting you.
There are several paths to parenthood. Determining the right one for you is largely dependent upon your cause of infertility. One of our first steps in creating a detailed, personalized treatment plan for you is diagnosis of your infertility issues. Your initial evaluation may include blood work, HSG, ultrasound, and semen analysis. Let's hear from some of our team members a little bit more about these tests.
Hi, my name is Tracy. I'm one of the nurse practitioners here at SRM in Spokane. One of the tools that we use is what's called a hysterosalpingogram, or an HSG. During this test, we inject dye into the uterus and fallopian tubes to assess the shape of the uterus and whether or not the fallopian tubes are open. We are fortunate to be able to do this test here on site in Spokane. We are also able to review the results with you immediately after the test is over, which gives us really useful information for the doctor to help determine your treatment plan going forward.
Hi, my name's Christie Hume. I'm a women's health nurse practitioner here at SRM in Spokane. And we use the ultrasound often as a tool for many things throughout your treatment here at SRM. Initially, we may use it to evaluate your uterus and ovaries prior to starting the treatment plan. And throughout the treatment plan, we will use the ultrasound to monitor follicular development of the ovaries through the cycle. And lastly, hopefully, we'll be doing an early OB ultrasound to check the viability of a pregnancy prior to transition you to care to your regular OBGYN.
Hi, my name is Derek, and I'm one of the clinical embryologists here at SRM, and today we're in the embryology lab. Approximately 40% of infertility is male factor related. In the lab, we will perform your semen analysis to evaluate the total volume of the sample. We will grade motility of the sperm. We will gauge your total concentration of sperm in the sample and evaluate morphology, which is the normal shape of sperm. Results will then be provided to your doctor for review and treatment planning.
On the day of your consultation, you will meet with our financial counselor and be assigned a nurse coordinator.
Hi, I'm Cameron. I'm the financial counselor here at SRM in Spokane, and my role is to help you understand the financial implications of your fertility journey. So once you've established a treatment plan with Dr. Hamard, I will then go over with you any insurance coverage that you have, as well as any expected patient responsibility, and discuss any financial options as well as assistance programs that are available.
Hi, I'm Katie. I'm one of the nurse coordinators here at SRM. You'll meet with us following your initial consult, and we'll help educate and guide you through your next steps, including diagnostic testing and subsequent treatment plans. You'll be able to reach us by phone, secure portal, or in person. We'll also work with you to create cycle calendars, order medications, and we're here to support you on your journey.
Your nurse coordinator will work with you to create your cycle calendar, order medications, and support you along the way. If your treatment plan leads you to IVF, you'll ultimately find your way to our surgical suite. Let's meet that team now.
Hello again. We are now here in our surgical suite. We have a state-of-the-art surgical suite which includes 3 pre-anesthesia beds and post-anesthesia recovery area. And we also have an OR, which I'll show you in a little bit. Most commonly in the surgical area, we are doing sonographic egg retrievals as part of your IVF process. We do some other procedures as well. Egg retrieval is that process in your IVF cycle where we're collecting the eggs from your ovaries. And then on the morning when you come in to get your egg retrieval, you'll be greeted by our staff and getting prepared for your procedure with us. We will bring you back into the OR where you will have your egg retrieval under anesthesia. Once we aspirate the fluid from your ovaries while you're asleep, of course, I will hand that fluid to our embryologists, and they will perform the finding of the eggs and then putting the eggs together with the sperm for the insemination. On completion of your procedure, you will come back into this area for your post-anesthesia recovery, and you'll be with us for about 45 minutes or so after your procedure. On the day that we do the procedure, we'll actually know the total egg numbers, but on the next day, we'll call you with the fertilization rate and see how you're doing after your procedure.
Hi, I'm Deidre Nichols, Senior Embryologist at SRM Spokane. I want to give you an idea of what goes on in the IVF laboratory. After your egg retrieval, we'll take the eggs and mix them with the sperm and attempt to fertilize all the mature eggs. We do that in using one of 2 ways. We can use the conventional IVF way, where we just mix the sperm and the eggs in a dish and hopefully let nature take its course. Or we can use the ICSI method, which is intracytoplasmic sperm injection, where we take one little sperm and inject it into the egg and hope for fertilization. Then we will culture the embryos for 5 to 6 days, where we will then either transfer back into your uterus or freeze them if they meet the criteria. We freeze and store embryos here at SRM Spokane. And then we can also perform biopsies on the embryos to send off to a lab for pre-implantation genetic testing, PGT. And then we are a member of the My Egg Bank Network, where we freeze donor eggs here and ship all over North America. And we also receive eggs from all over North America and thaw those and culture for our recipients.
Hi, I'm Molly. I'm another of the clinical embryologists that are working hard for you behind the scenes here at SRM. And this is where you prepare embryos for transfer. As Deidre mentioned earlier, we do embryo transfers on day 3 or day 5 if they are fresh embryos that have been culturing here in our lab. We also do frozen embryo transfers, which are a little bit different. They were frozen from previous cycle and have been waiting in storage. The morning of the transfer, the embryo has to be thawed and then given a little bit of time to warm up and re-expand before we can put it back into a uterus. So here I have an embryo to show you that's ready to be loaded into a catheter that the doctor would use for placement. And there we go. Then we'll wait semi-patiently for your pregnancy test. And let me assure you, we are all crossing our fingers and toes right along with every single one of the patients.
We understand that infertility and its treatment can be an emotional roller coaster. Taking care of your emotional and psychological needs is just as important as caring for your physical needs. Our fertility counselors are here to complement you in your fertility care at SRM and support you through the experience.
Hi, my name is Melanie Mickelson, and I'm a licensed mental health professional at Seattle Reproductive Medicine Spokane. And I am here to help give support during your journey of fertility treatments. And we know that that can be a stressful time and a hard journey. We want you to know that you're not alone. We see patients in person or Zoom counseling sessions as well. I can also be an advocate for you as far as resources outside or any ongoing support you might need.
We provide additional services specific to the unique needs of our long-distance and LGBTQ patients. Our goal is to make each patient's experience as convenient, comfortable, safe, and successful as possible. We're proud to offer our patients the highest level of personalized fertility care in the Spokane area, and we look forward to the opportunity to walk alongside you in your path to parenthood. For more information, visit our website at www.seattlefertility.com. Thank you.
Thank you for watching our video, and I look forward to meeting you in person here in the clinic.